October is Breast Cancer Awareness Month, and last Monday we talked with a Sanford expert about screening guidelines and other ways that healthcare providers can detect breast cancer. Well, today we are talking about breast health once again. We're focusing on breast cancer survivors and helping researchers pave the way for even better, more personalized screenings. And here today to talk about some new studies going on, we have Nancy Anderson and Andrea Mell, nurse navigators at Sanford Roger Maris Cancer Center. And I focus on nurse navigators. It's kind of a new term for me anyway. So before we even get into some of the new research, I was wondering if you guys could tell us a little bit about your roles at Sanford Health.
Sure. So a nurse navigator is basically somebody who is with the individual and their families throughout the whole process. So we're able to help coordinate appointments for patients as soon as they're diagnosed, just serve as a primary resource to them and their families, help connect with resources for nutrition, social services, transportation, that kind of thing, and just kind of being there as a resource for them throughout the whole process.
It really, breast cancer affects your whole life, not just, when you're in a doctor's office. So that's interesting. Nurse navigators, I like that. Okay, so we want to talk today a little bit about two of the breast cancer research programs that you guys have going on at Sanford. Can you talk a little bit about that? Because we know Sanford, Roger Maris, you're known for research as much as great care.
Right. So our clinical research team, they work hard looking at treatment options and clinical studies that in regards to breast cancer treatment. But two studies that we have currently going on look at breast cancer screening on the opposite end. So we have one called TMIST, which looks at the technology 2D versus 3D, and that's open to women who are having a screening mammogram ages 45 to 74. And then we have another study that's really interesting called the Wisdom study. So that looks at a woman's breast cancer risk factors, and it helps them personalize what their screening recommendations might be based on their personalized breast cancer risks. And with the Wisdom study, women have an option to have a genetic panel done to look at any high-risk features that they may have in their DNA. And then we're able to provide them with a recommendation. And that study is open for women who have not had breast cancer and who are ages 40 to 74. And we're working with the University of California with that study.
That's super interesting. I want to kind of expand on that because I feel like we have, every once in a while we do a little bit like genetic testing caught this, or genetic testing, put up a flag on certain things. And I guess we have not necessarily talked specifically to breast cancer and the genetic testing. What can someone expect if they go in for this Wisdom, study?
So if they, there's two arms of the study, and women are randomized to either the annual arm where they just have their mammogram every year, or the personalized arm. If they're in the personalized arm, they get sent a genetic testing kit, and we look at 9 genes that are associated with breast cancer risk and a variety of what we call SNPs, which are little genetic variations that can increase a woman's risk for breast cancer.
Okay, interesting. Okay, so that's the Wisdom. You said TMIST is different. Do you want to talk to that, or are you?
So TMIST is looking at the technology of 2D versus 3D, and just want to make sure that we're offering the best technology for our women to be able to find cancer at the earliest stages.
Okay. I love the idea of, I feel like whether you're doing it just for yourself to see where your genetic, life is, or you're helping others too when you're doing genetic testing, right? Not only your own risk, but it's going into the research for everyone.
Correct. Yep. And we're learning more about the SNPs, the genetic variations, with this study too.
So how do you get started? If someone's watching at home and they're like, well, I want to know more, I want to do the genetic testing, what's the first step?
If you go to the etasanford.org website, the Wisdom study is a self-consenting study, so women can click on the link and join the study on their own, from their own home computer.
Okay. Interesting. And you touched a little bit on just the basic, what we should be doing for our own health. In case people haven't watched every single Monday, can we just talk a little bit about how important it is to get your mammograms and what has changed as far as getting your mammogram when you're a woman of age?
Sure. So a mammogram is the best way to detect breast cancer at its earliest possible stages. So especially getting it yearly so that the radiologist can compare any changes from year to year, whether they need to watch something or finding just subtle changes that may lead them to a biopsy and potential diagnosis. And then just some other ways to decrease your risk would be knowing what your risk is, and these studies are great ways to figure that out. Also just maintaining a healthy weight, especially after menopause. Weight gain is tied to a higher risk for breast cancer, physical activity, and then limiting your alcohol intake to 1 drink per day or less. And then, yeah.
And talking to your physician about these things is important
Yes.
too.
Yes.
We talk about, the mammograms, yes, but there are other, things that you should be doing, like you just mentioned. So have that conversation with your doctor sooner than later, even if you don't think you're at risk.
Right. And even just talking to your provider, if you notice any subtle changes, you know your body the best. And just because you don't have a family history does not mean you can't get breast cancer. So advocating for yourself and talking to your physician about any changes or concerns.
And self-exams, those are still encouraged as well.
Yep.
Yes. Yep.
Yep, breast awareness. So
Breast awareness.
Yep.
It's all about breast awareness, breast
Yep.
health. This is the month to have that conversation and just be a little
Absolutely.
more aware too. Thank you, ladies, for coming
Yes,
in.
thank you.
It's always interesting to know about all the new research and the studies that are going on as
Yep,
well.
it's
So
exciting. So,
appreciate it.
Thank you.
Stay with us. Coming up next on North Dakota Today, we're going to find out what's new at your CBD store.